Here is exactly how the CNO exam works and how to pass it in just a few minutes. The CNO exam is what you pass to become a certified nursing assistant. And the first thing to know is that it is not one test. It is two: a written knowledge test and a separate hands-on skills evaluation where you actually perform care in front of an evaluator. You have to pass both. About half the states test under the National Nurse Aide Assessment Program. There, the written test is 70 multiple-choice questions, and you get 2 hours. You are told when 15 minutes are left. Other states use a different testing vendor with slightly different numbers, so confirm yours with your state registry. The structure is very similar everywhere. If reading English is difficult, many states also offer an oral version instead. 60 questions read aloud to you, plus 10 reading words that check you can recognize common job terms. You have to pass both sections of it, still within 2 hours. The skills evaluation is 5 skills, and here is the part people do not expect. Hand washing is always one of them. Always. The other 4 are pulled at random from your state's skills list, so you cannot afford a favorite. Your state sets the passing standard, and it usually lands somewhere around 70 to 80% on the written test. If you fail one part, you only retake that part. But fail either part 3 times, and you have to complete a training program again and then retake both. To sit the exam at all, you need to finish a state-approved nurse aide training program. Federal law sets the floor at 75 hours, including at least 16 hours of supervised hands-on clinical training. Most states require more than that, so check your state's registry. Now, what is actually on the written test? 3 content areas, and they are nowhere near equal. Study where the points are. Physical care skills is 64% of the exam. The role of the nurse aide is 26%. And psychosocial care skills is 10%. Inside those, one slice is bigger than all the rest. Basic nursing skills alone is 35%, more than a third of the whole test. Activities of daily living adds another 22. So vital signs, infection control, bathing, feeding, and transfers are where most of your points live. And here is the thing that should change how you study. Almost nothing on this test is a fact you memorize. Nearly every question is a small scene. A resident does something, and you choose what you do next. The right answer is almost always the one that protects safety, stops infection, or respects the resident's rights and dignity. 3 real questions. First, you have been caring for a resident with C. diff, a diarrhea infection. You take your gloves off. How do you clean your hands? Soap and running water, not hand sanitizer. C. diff forms spores and alcohol does not kill them. You have to physically wash them off. Second, a resident is weak on the right side after a stroke. When you dress them, which arm goes into the sleeve first? The weak side goes in first, and it comes out last. The clothing is loosest at the start, so the affected limb goes through with the least strain and the least pain. Third, you are slammed with work, so you ask the nurse to put a vest restraint on a resident who keeps wandering, just so you can finish your tasks. Why is that improper? Because a restraint may never be used for staff convenience. It takes a doctor's order, for a documented medical reason, after less restrictive measures have failed. Freedom from restraint is a resident right. So how do you prepare? 4 habits. First, drill practice questions until the safe answer is automatic. Do not aim to just scrape past your state's cutoff. Aim well above it, because test day adds nerves you did not practice with. Second, master the vocabulary. This exam turns on single words: sterile versus clean, objective versus subjective, sign versus symptom, dangle, ambulate, supine, and prone. One term you do not know can cost you a question you actually understood. Third, write down every miss and write down why the right answer was right. Then weight your study time toward physical care, because that is nearly 2/3 of the test. Fourth, run every scenario through the same order. Is anyone unsafe right now? Then, could this spread infection? Then, does this respect the resident's rights and dignity? Read all the way to the end of the question and watch for the words first, best, and next. And practice your skills out loud, because the steps you perform for the evaluator are the same steps this written test asks about. So remember, 2 exams and you pass both. 70 written questions in 2 hours. 5 skills, and hand washing is always one of them. Physical care is 64%, and nearly every question is asking you one thing: what is the safest, most respectful next step? Start now with free C and a practice questions at .com/en/CNA free, in English, Chinese, and Spanish, with no sign-up.